You are watching the Doctalk show.
Welcome back. We have learned that diabetes causes blindness. Yes, it's true. Diabetes, if it's uncontrolled, if it's unchecked, can cause permanent loss of your eye vision. So I want to understand exactly how one can tell they might be getting this problem, which is caused by diabetes. So Dr. May, how can one know that their eyes are being affected by the diabetes? Is there any way they can tell? Do they get some sort of pains or headaches?
Actually, the eye diseases that the patients we see have, it has a silent onset. They don't have pain, but usually they keep on noticing that the vision is reducing. Therefore,
They stop seeing clearly.
yes, they stop seeing clearly. Your vision is blurred. It's like you're seeing through a curtain. So those are the tell signs that actually the diabetes is starting to affect your vision.
Or it has already started to affect.
It has
By
already
the time it
started,
starts causing those problems, usually
Yeah.
there's some
There's some
degree of
damage.
time that has
Yeah,
passed. Yes.
that has passed. So at that point, it is very important. Really not at that point, but if someone with diabetes gets those signs of vision loss, then they should run to have an eye checkup. However, it's actually advised that at the point when someone gets to know that they are diabetic, they should come for an eye checkup.
They shouldn't wait until their vision
they
starts
shouldn't
changing.
wait until their vision is poor.
Just how many people do you see who come to the hospital? How many of the diabetics actually have this problem, the eye disease? Dr. Daniel.
Yes, thank you, Doctor. The patients who report to eye department in Mengo Hospital already have complaints. We do have very few patients who walk in and ask that, check my eyes, I may have any problem because I'm diabetic. And this is very important that we emphasize that whoever has been diagnosed for diabetes should come early, because we have known that the disease is silent. So we have to look for this disease, and it is only in the hospital that we can find that the disease is there. If we identify it early, then we manage it. At Mengo Eye Department, we see about 10%, or roughly about 600 patients per year who have diabetic eye disease. And among these patients, some of them go without treatment, but most of them will end up getting treatment. And about 40 patients per week receive various treatment related to diabetes, from laser, injection of medicine, and surgery.
So it is really a big problem.
It is really a big
over 600, and that's only in one hospital. You're already seeing 600 cases of the eye disease due to diabetes. So one wonders, how is it now in the entire country?
That's true.
Are there any risk factors that can predispose someone to get diabetic eye disease? Dr. May.
Well, really all diabetics, if someone already has diabetes, they are at a risk of getting diabetic eye disease. But the concern is, when are you getting it? And duration, the time which the person has taken with diabetes, the longer the time, the higher the chances of getting the diabetic eye disease.
So the longer you take with diabetes,
yes, the higher the risk
of the eye disease.
The eye disease.
Okay.
Now, also, if there is poor control of diabetes, we see people walk in our clinic with very high sugars, and they are saying, my vision is poor. And at that point, the only point is to refer back to the physician to first control the sugars, because it is the root, the diabetes is the root of this poor vision.
It is the high sugars that are causing the ongoing damage.
Yes, so if you have not controlled your sugars,
longer period. You have been having high sugars, and it is going for long, 1 month, 2, 3, 4, 5, that's where the problem starts.
So those are two categories of people. People who don't know they have the diabetes,
Yes.
they have high sugars.
Yes.
Even those with diabetes and the sugars are not controlled,
Yes.
they are both at risk of getting
Yes.
the eye disease. Okay. So apart from the duration and age, could there be anything else?
But we could really concentrate on the sugar control. Many people may not really understand what are you saying. When you go to your physician and they measure your sugar, then your physician will discuss with you that we want to bring this sugar to a certain level. Say you want to bring it to 10. That is what you have agreed on. Every time they measure your sugar and it is above 10, you should be worried because it is not controlled. And you should ask your doctor or whoever is managing you to help you how we can control it. In that way, that is the only way we can control the sugar. If you get pregnant, you stand higher chances of developing diabetic retinopathy faster.
If you have both
Yes.
diabetes
and you are pregnant. Actually, we encourage that just as you notice that you are pregnant, you should come and we check your eyes. And we encourage that after every 3 months, we should check your eyes to make sure that you don't develop diabetic eye disease.
Okay.
There are other disease conditions like high blood pressure. If you have high blood pressure and you have diabetes, there are higher chances that you can easily develop diabetic eye disease. So therefore, it is important that the pressure is also managed well. So that if it is managed well, then the progression to diabetic eye disease is reduced.
You see, the high lipids in the blood, they
Or the
add
cholesterol
Yes.
lipids.
Yes, so they add to, they go and clog the blood vessels. They're already very thin and they clog, so they bring blockage. So all those are factors that need to be put down such that to reduce on the risk of getting the diabetic eye disease. Then we're talking about smoking. It has been also associated with the increased risk of developing the diabetic retina disease. Then people who are obese, overweight. Yeah. So those are things which we are talking about, and someone can do something about it. It's either the patient or the health worker, but something can be done about it, such that the risk of getting this diabetic retina disease is reduced.
And some of these factors can be changed.
Yeah.
Okay? We can't change the fact that you'll grow old.
Yeah.
Or you won't change the duration of the disease.
No.
But you can control your weight.
Yes.
You can control your blood pressure.
You can control your blood sugar.
even the blood sugars.
Yes.
You can reduce the amount of cholesterol in the blood. All these measures can help reduce the propagation of the diabetic eye disease.
Yes.
All right? And so when we come back after the break, we shall understand whether if you have the diabetic eye disease, what next? Is there a treatment? And better still, can we prevent ourselves from getting the eye disease? So you can send in your questions and comments on the social media platforms. That's Facebook, Twitter. You can also log onto the Doctalk show on the YouTube page and watch some of these videos. Remember, this show is sponsored by the Ministry of Health. Don't go away.
You are watching the Doctalk Show.